silver filling is a mercury filling. Not politically correct in the past to call them mercury fillings, but they're 51% mercury. So it's truthful that it's a mercury filling. There's at least 5, 6 different metals in a mercury silver filling, and the 51%, as I mentioned, is mercury. And then a certain 15–20% is silver. And then there's tin and zinc and copper and iridium and who knows what else. Mixtures of different metals. When they're mixed together, what causes them to become solid in the mouth is the mercury. The mercury is what allows them to be mixed together. It's been taught, at least when I was in dental school, that they were safe and didn't give off that mercury once they were placed in the mouth. And we've known for decades that that's not true. The truth is mercury for decades after they're placed in the mouth is released into the body. It's the mercury from the silver, mercury, tin filling, which is all the same thing, is constantly released every time we eat, chew, swallow. It's the mercury from the fillings in the mouth is the #1 source of mercury toxicity in the body. The mercury from the fillings is neurotoxic. It doesn't just travel down into our stomach and then into our bloodstream from the mouth. The mercury travels in the tooth to the nerve inside the tooth and travels along the nerve, destroying protein in that nerve, and travels along that nerve from the tooth directly to the brain without stopping, without having any barriers or walls or partitions or guards that say, no, you can't pass this way. It will go within 5 minutes into the brain and has a toxic effect on nervous tissue and brain tissue. As important an issue as mercury is, I feel that the cavitations and the periodontal issues need to be addressed, because we're dealing with, as a biological dentist, or just a dentist in general, that our goal is to eliminate, reduce infections. And so that we're talking about periodontal disease and cavitations, we're talking about infectious processes. Frequently, the body's learned and adapted to try to balance itself with all these forces coming against it, whether it's infection or heavy metals, so that frequently if a patient is ill or in great need, the dentist has to make the decision, is this a patient where interventions required to clean everything up within a short period of time, or is this an intervention that this person, this body can only handle very baby steps, slowly recovering through the process of cleaning infection, heavy metals. For heavy metal, mercury, toxic filling replacement, there are protocols to protect the patient, and those protocols involve physical barriers. They involve protection within the room of air cleaners, air filters that capture the particles, so you don't walk into a dental office that's loaded with mercury toxicity in the air and in the fabrics and so forth, and that you have that protection that provides barriers for you, for your breathing, for your swallowing, for every aspect of that dentist is going to be conscientious in its removal. The removal process is protected, but the removal process itself is important to do in a proper sequence. And the way that sequence is determined is by taking the worst mercury filling out first, the second worst next, and so forth. And the way that's determined is that those mixtures of metals that we talked about with the mercury and silver and so forth are just like a 9-volt battery or a 12-volt battery or any kind of a battery. Those are made of mixtures of metals. These mixtures of metals in the mouth create a battery effect that will give off microvolts of current and that current causes the filling, the mercury and so forth to come out at a much faster rate if the current's high. So when the dentist goes to replace those fillings, he wants to take out the highest electrical charge first and then the next highest and so forth. So it becomes a sequential removal. Recovery is more effective when it's done with that protocol. Many patients will have biocompatibility tests done. That's a serum test that looks at what's safe to put back in the body, what will react with the person's own immune system, and that can be known ahead of time. It's a very complex test, simple to do, but just send in for the patient, but very complex results come back that guide the dentist in what is replacing those fillings. And these are biological materials that are placed to be biocompatible. Most are very aesthetic, look more like the natural tooth than a black silver mercury filling does. We see people who respond quickly. Majority of people, it's a step-by-step process of healing. The body took a long time to break down to get into this condition that they're facing now, and so that it's reasonable to expect with a team effort, the patient being a big part of that team, following directions and being well educated, and then working with the biological dentist, the holistic physician, the acupuncturist, the spiritual and psychological needs that that patient has, can expect step-by-step recovery. Everyone's going to respond in a different way, but I would encourage people to be patient and know that this is going to take time. Six or 7 years, all mercury fillings are going to have decay under them. We just find that to be true. So that in the normal course of their life, apparently they're good excretors of mercury from what's been there, but use good reason, use sound judgment, and as a filling looks like it needs to be replaced, pick the correct materials, biologically compatible materials that are non-reactive to the body and are going to make the tooth healthier, look better, and get rid of the decay. It's great prevention. These decays that are underneath the mercury filling that progress slowly over time can damage the nerve and cause complications of an abscessed tooth and all kinds of things. So don't treat it as an emergency. You have to rush out and get these out, because if it's not done properly, you're better off just to leave them alone. But know that in time, 6-7 years, there's decay under them. So you wouldn't want to drive on tires that were down to the threads, and these fillings are down to the threads, so it's time to replace them.